And let me remind you, when I took office about 14 months ago, the pandemic was raging, the economy was reeling, and the deficit was soaring. Most schools were closed. We didn't have enough vaccines. The unemployment claims were sky high. And then we got to work and we delivered. Enough vaccines for every American months ahead of schedule. Effective treatments, at-home tests that are free and accessible. Over 99% of our schools are open again. Businesses are open again. And because of how we responded, we created more jobs last year than ever before. 6.7 million jobs. And by the way, we did it while cutting the deficit, the largest one-year deficit reduction in American history. Say that again, the largest one-year deficit reduction in American history. But none of that happened by accident. We're able to do it because we coordinated across the government, partnered with state and local leaders, governors on both sides of the aisle, and the private sector to leverage every resource we had to fight against this virus. We left no stone unturned, and we were able to do it because Congress worked with us and provided us the necessary funding. But now, just as we've reached a critical turning point in this fight, Congress has to provide the funding America needs to continue to fight COVID-19. We're already seeing the consequences of congressional inaction. The monoclonal antibody, take monoclonal antibodies, for example. They've helped save lives. This isn't partisan, it's medicine. But Congress hasn't provided enough money to keep purchasing these monoclonal antibodies. We've had to cancel planned orders and cut the supply we're sending to the states. Without more funding, we'll start to run out of them by the end of May. We've also had to scale back our plan to purchase more preventive therapies for Americans who are immunocompromised. Critical tools to protect the most vulnerable among us. Without more funding, we risk running out of the supply by this fall. The same is true of testing. It took months to ramp up our testing capacity. The Omicron, we saw how vital, and with Omicron, we saw how vital it was. And we have enough tests on hand to weather the surge. But without funding, we're not going to be able to sustain the testing capacity beyond the month of June. And if we fail to invest, we leave ourselves vulnerable if another wave of the virus hits. Look, on vaccines, and most important tool in this fight, we're also running a risk. Yesterday, the Food and Drug Administration, the FDA, and the Center for Disease Control and Prevention, the CDC, authorized the fourth shot for those 50 years and older. We know boosters are critical to providing an additional level of protection. That's why I plan to get my second booster today, right here after I'm done speaking. If you haven't gotten your first booster, please don't wait. Do it today. Those who are 50 and older, as well as those who are immunocompromised, can now get even more protection than they have from the initial first doses. We have enough supply to give booster shots to those newly eligible individuals. But if Congress fails to act, we won't have the supply we need this fall to ensure the shots are available free, easily accessible for all Americans. Even worse, if we need a different vaccine for the future to combat a new variant, we're not going to have enough money to purchase it. We cannot allow that to happen. Congress, we need to secure additional supply now. We can't wait until we find ourselves in the midst of another surge to act. It'll be too late. And we also need this funding to continue our efforts to vaccinate the world with commitments we made. It's critical to our ability to protect against new variants. There's no wall you can build high enough to keep out a virus. Congress needs to act now, please. Let me close with this. I've worked so hard to get our lives, all of us have worked so hard to get our lives back. We're summoning every ounce of American resilience, pulled every lever of our government, called upon the goodness, decency, and patriotism of American people. Together, we turned an unthinkable pain into an extraordinary progress and purpose. Americans are back to living their lives again. We can't surrender that now. Congress, please act. You have to act immediately. The consequences of inaction are severe. They'll only grow with time. But it doesn't have to be that way. We've proven what we can do when we work together. So I urge Democrats and Republicans to get this done with urgency. Let's stand united. Let's continue to pull together. Let's get this done. Thank you, and God bless you all, and may God protect our troops. And I'm going to get my second booster shot. I'm not sure why I'm doing it on stage, but I have to do it again.
Mr. President, what is the danger of Putin being left in the dark by his military advisors?
I'm reluctant to comment.
Can you comment on the declassified intelligence that he doesn't trust his military leadership since it is declassified?
No, I can't.
Provide security guarantees to Ukraine as part of peace talks.
Doing great.
Is the U.S. willing to provide security guarantees to Ukraine as part of peace talks?
All right.
Mr. President, are you going to extend Title 42?
We'll have a decision on that soon.
What did President Zelensky tell you about the...
Recent 4 countries of vaccination will impact the fight against COVID here.
What did President Zelensky tell you about...
Somebody asked me about the vaccines.
Mr. President, what did you hear from President Zelensky today about negotiations with Russia?
I've always thought that it discourages people getting the vaccination when they watch people get a needle in their arm. So I apologize for discouraging them. It didn't hurt a bit, and I was able to roll my sleeve up, and thank you all for
Mr. President, while they're here in Washington, they say that you promised them a meeting.
I'm going to see if I can get to see them.
Today?
They're good people. I haven't. We're trying to work that out. Thank you.
What did President Zelensky tell you? What did President Zelensky tell you about negotiations?
And we've been watching President Biden get his second booster shot and update the administration's COVID response. The president says the pandemic is not over, but it will no longer control us.
The president is also calling on Congress to provide more funding for testing and for vaccines. Joining us now is John Moore. He's a professor of microbiology and immunology for Weill Cornell Medicine. Professor Moore, thank you for joining us. Now, as you probably heard, the president says we're at risk of failing to combat the pandemic without additional funding from Congress. We know that cases are declining and restrictions are easing across the country. We've been told COVID's here to stay, that we need to learn to live with it. So how vigilant do we need to be moving forward, and for how long?
Well, I thought the key message there to Congress was absolutely spot on. I mean, it disappointed all of us in science and public health earlier this month when a funding impasse arose that really will have serious real-world consequences if it's not worked out. And there are going to be shortage of funds for essential medicines in the near future, next few months. And a key point is that it's making it very difficult to plan vaccine and drug supplies for next winter. Now, we're batting 2 for 2 in major winter surges in COVID in 2020 and 2021 winters. So while we all hope that there won't be another major surge this winter, nobody can say that with certainty. So it is absolutely prudent that we make the most appropriate plans for what could happen this winter, and you simply can't do that at government level if you don't have funds. So something that should be bipartisan and pretty routine has just got bogged down in the kind of petty bickering that so typifies how Congress acts nowadays, and that's very disappointing, and it absolutely has to change.
Professor Moore, the president also highlighted his administration's Test to Treat initiative. Which Americans in particular do you believe should be taking advantage of the free antiviral medicine the White House is providing?
Well, COVID mostly affects people who are in the older age ranges. Over 65 is a a watershed for becoming seriously increased risk of severe disease and death, and people with medical conditions that place them at risk. And, after 2 years of the pandemic, everyone should have a pretty reasonable idea of where they fit, how healthy you are in the risk spectrum of getting severe COVID and death. And, there's a world of difference between a healthy 25-year-old athlete and someone in their 60s with diabetes, heart disease, and other predisposing conditions. So people need to be aware of where they are and how they can get access to drugs and preventative strategies that they need. And I had not heard of this new covid.gov website, but it sounds like a good thing because it unquestionably has been difficult to navigate all the resources via disparate websites and government and non-government resources. So having everything in one place does seem like a good idea that people can then work out how to get more test kits. When you use a test kit, if there's a lot of virus in your local area, or if it's really on the uptick, it's quite low at the moment, but it's probably only going to go up, not down from here. If you're considering going to an environment where you're mingling with a large number of people and would place yourself at risk of getting infected, particularly if you're in a vulnerable group, then you need to know how to get access to the testing materials and how to use them. And if you're immunocompromised, getting access to monoclonal antibodies to treat COVID as soon as you get signs of an infection is very important, so that these drugs work best. In fact, really they only work at all if you're using them in the first week after symptoms, in the first few days. But you have to be able to test yourself and get an accurate result and know if you then need to ask your physician for access to drugs that will stop you getting into hospital. So all of these measures are good, and public awareness is increasingly, and has been all along, very important.
Professor, is it fair to say that we're at the point where we are living with COVID as opposed to trying to eradicate it? And what would that mean for people as they go about living their lives?
Well, we are living with COVID. I mean, the current national infection rate is around 30,000 detected infections a day, and that's pretty much an all-time low since testing ramped up in 2020. Early on in the pandemic, we didn't have any testing, but since testing became widely used, 30,000 infections nationally a day is as low as it's ever been. So that means we can, for the most part, get on with our lives, particularly if you're vaccinated and particularly if you behave with a reasonable amount of common sense. I mean, again, personal assessment of your risk is an important thing to do. So there's no need for people to lock themselves in their basement, but you have to be aware that you could place yourself at risk if you go to a crowded environment and are not fully vaccinated and decide not to wear a mask. There is a risk, and you have to assess whether you're prepared to take it or not. But, we also have to be on our guard. I mean, the virus hasn't gone away, and there are the BA.2 variant is particularly transmissible. It's resurging in Europe because of reduced restrictions on daily life and the sense that the pandemic is over and everyone can go out and party. So then you get an uptick in cases, and we need to be on the lookout for that. It's not impossible. We'll get another surge over the summer. We just really hope that does not happen.
John Moore, thank you for your expertise. We're going to take a quick break. More news coming up next here on CBS News.
When these Holocaust survivors are gone, who will warn us to never forget? When some people don't know. Undeniable. The Truth to Remember. Streaming now.
An original CBS Reports documentary.
Some Republicans are now accusing companies like Twitter and Facebook of targeting conservatives.
They've had